a bit about the hospital, New Children's Hospital, but also a little bit about happening in Children's Health Ireland. And then, as always, it's as I say, the questions is where I hope to answer any that you may have at the end of it. So just again, a background of what Children's Health Ireland is. So a year and a half ago, we merged the 3 children's hospitals. So we're one board, one executive, and we provide services to all of the local children in the greater area. And then, of course, national paediatric services like haemophilia, and then some on an all-island basis like our cardiac services. As I say, children are 25% of the population, so it is, estimated that about 16% are children with chronic diseases, and obviously some rare diseases like haemophilia, and 2% are acutely ill or complex, and they require our national services. There are 3,600 staff delivering services to 3,050 children annually in CHI across the 4 locations of Crumlin, Temple Street, Tala, and most recently, last year, our services at Connolly and Blanchardstown. We have a very clear model of care to have an integrated approach to paediatric health services. Primary principle is to clinical care to be treated as at home, if at all possible, or as near to the child's home as possible, depending on their clinical needs. I don't need to talk to you about a network, but it's very important that local care is clinically as appropriate. The child should not be admitted if they don't need to be admitted. So that means done either through emergency urgent care, daycare, or outpatients, and only admitted if required. And then, of course, the plan is to consolidate all the inpatient services that for major tertiary, certainly services into the New Children's Hospital. So CHI is currently, as I said, 4, on the right-hand side of the screen, 4 locations. We work with our regional paediatric units in Cork, Limerick and Galway. There's also in Drogheda, Waterford and others that are very pretty focused on paediatrics. And again, we have a good link with our colleagues in Belfast and all of the local units. And increasingly, we're trying now in this post-COVID environment to open up services very much in a networked way and seeing what needs to be done where. So adding on to that, then there's 3 new facilities. As we know, Connolly was opened in summer of last year. Tala was supposed to open at the end of the year. It had the building site, as you can appreciate, has been closed due to COVID-19 and government restrictions. So we haven't got a reopening date for that. There's discussions going on at the moment. So the closing date for that could and probably will be impacted by the stoppage. And the New Children's Hospital is significant work being done there. And again, that's planned to be open in 2023. But again, subject to, I'd say, a new programme coming out post-COVID and what COVID means around the construction industry. So big highlights for us is, well, I mentioned the 350,000 patients. So that obviously is made up of all those number of inpatients, day cases, outpatients, and ED attendances, and obviously the urgent care attendances that we've been having in Blanchardstown. And 442 beds, and that's against 473 beds in the New Children's Hospital and 24 short-term beds in the ED. We have made a big effort. We know we have a challenge around access, and put a big effort in last year to try and reduce outpatient and day case and inpatient access, and had started to make significant inroads to that. So we, in particularly, while overall we had a reduction of 14%, because of the investment we made and the way we're working with Connolly, we actually managed to make a material impact to our general paediatrics of a 70% reduction, waiting over 12 months, and almost 40% reduction. And the whole idea was to, with opening the services at Tala, was to have no waiting for general paediatrics, which should be, the way it should be, supporting our GPs, so that we can actually get children seen very much in an ambulatory way and sent back. And then, of course, obviously since March, that has been materially impacted, and we are currently in our phasing up plans. The 2-metre social distancing rule is severely impacting on what we can do, because our infrastructure, particularly some of the infrastructure here in Crumlin, and obviously a lot of it over in Temple Street, is really poor. And we will be opening up services again in Tala at the end of August. And we're now trying to, as much as possible, squeeze as much as we can into Connolly in the over the summer months. We're on a big digital journey, and some of this is related to the new hospital, but it's some of these systems are what we're implementing now and will move to the new hospital anyway. So because digital transformation is probably the biggest challenge, and the actual physical move into the new buildings, that we want to try and embed as much as possible these systems into the existing ways of working. So we're looking very much for a single patient administration system that's called IPIMS. And so currently we have 1.2 million records. That was implemented in 19. There's probably 1.5 million records now. And that means that the clinicians can actually access their admission, their discharge data from the other locations, which helps with moving the patients to where the best place for them to be seen. Symphony is our ED system, and we're currently, again, we were supposed to roll that out over COVID, but we just had to postpone it, but we're working on that to get it in. So there's a single platform across the EDs. That's very important, particularly for a child protection issue, that their children haven't been moved around the EDs with injuries. A single integrated medical imaging system is X-rays. So normally in the HSE they have a national system, and this called NIMUS that people might be very much aware of. It's a good system, but every hospital that they put it in is a new instant. But in CHI we wanted the clinicians to be able to see them no matter where they were. So Crumlin, Temple Street and Connolly are up on the same instant, which means that the clinicians there can see the X-rays of any patients. We weren't going to do Tala because it's actually on their adult system, but the new facility in Tala will be on the same NIMUS system as Crumlin, Temple Street and Connolly. And then one of the most exciting things that definitely has accelerated in the last few weeks has been our virtual clinics and referrals to triage clinics. So we have 2 new IT platforms that have been rolled out. So Attend Anywhere is a virtual clinic, so it supports video and teleconferencing, and it has been approved by the HSE as the system. So we're currently rolling it as a pilot in Temple Street, and it has gone very well with very positive responses. We've some of the specialties here in Crumlin are now implementing it, and it'll take probably 6 to 7 weeks to actually fully implement, but been very positive feedback. And SwiftQ is a way of whereby we're able to roster the referrals in an electronic way, so we're able to send them to whatever site has the next clinic availability. And we're very much looking at this to see focusing. Sorry, is that okay? We're focusing on chronic disease management and those waiting the longest, and then trying to see what patients do need to go for face-to-face. And then finally, the EHR, the electronic healthcare record. So we got approval last year to proceed to this, so we commenced that procurement process. So we've gone through the first phase, and we now have 4 vendors that we're engaging in the second phase of competitive dialogue procurement process, and that's going to kick off from midsummer. And Brian and colleagues, you might be interested in this one because we're very keen to ensure that this isn't just around what clinicians see as the clinical information system. We see it broader this, and we have engaged with representatives from a family forum perspective and IPOSI as well, who actually are in this space about working towards a patient engagement in designing digital health, that we will be actually seeking engagement and involvement of patient advocacy groups and representative bodies in actually designing how this system works, not just for the CHI as a provider, but also for the users of the services. So for example, how can it actually help with our plan to ensure that as much care can be given locally as possible and doesn't all need to be coming up to Dublin if not necessary. So I think, Brian, that might be something that you might be engaging, might be interested in, and we can come back and discuss that with you to actually get IHS
Eílish,
involved.
we're absolutely interested in that. And indeed, we have a focus group at the moment from the Society working with the National Coagulation Centre, looking at the rollout of the patient portal. So that would fit in very well.
Yeah, you've great experience, I think, on this, so I think we could work together. And the whole process, Brian, is a competitive dialogue process, is that it's shaping the tender. So we shape the tender, and then the bidders bid to it, 1 to 4 of them, depending at the end of it. So we need to shape it so that they respond.
Yeah, we've used that process, Eílish, for haemophilia therapies for the last couple of years. We actually find it gets us better results as well, because you really up the competition.
Yeah. It's a lot of work, but it's well worth it.
Yeah.
No, thank you for that. So I will probably come back to you, Brian, if that's okay, in a separate email, and link into our leads in the electronic healthcare record, if that's all right.
Absolutely. Great,
thank you. So back to the pretty pictures and the project itself. So this is a TS, what's that, transverse section of the hospital, and you can see this actually is the ED department, and all the actual rooms mapped out on the, we have this building information management system. And you can see half the semicircle there that actually is the warded area, and the big concourse area in the middle, and the 2 smaller buildings of the post stamps are actually the 2 paediatric outpatient urgent care centres at Connolly and Tala. So just to reorientate people on the site at James's, so you'll be cognizant of the blue area is the adult hospital. There's still plans, proposals in from a planning perspective for the Children's Research and Innovation Centre at the top of the screen. The green areas where the planned future maternity to be based, and then the 12 acres that is the Children's Hospital being currently built on at the moment. And working again closely with our Ronald McDonald House charity colleagues to ensure the family accommodation is included, and again planning permission has been secured for that. So it's a massive development. So across the 3 buildings there's 6,150 rooms. There's actually a total of 5,109 rooms in the Children's Hospital. The reason we know that is we're actually down to equipping those rooms at the moment and planning what, like we're down into toasters or whatever is going into kitchens, down into, what pieces of equipment going into every room at the moment. Predominantly, obviously, it's all single room based, which is fantastic, considering the challenges we have with pandemic and an increase in our day beds. Parking, of course, has been very important for families, with 675 dedicated to families and 31 spaces at the top for emergencies. Very clear, want to work on the tri-located way, so we're continuing to work with our colleagues in the Coombe and James's about developing co-location opportunities, and a lot of that has been very much around the back of house, which is appropriate because it was relevant to the design. And now we're moving into clinical services. So what clinical services would have benefits? And obviously massive one for haemophilia and whole hematological and oncology in general with James's, which is of course the other centre. So I think maybe we're into our service blueprints at the moment about how the future hospital is going to work. As that goes on later on in the year, then Brian and colleagues, we will be actually narrowing it down to the operating model. And then that's where things can come out to see where can sharing actually take place with James's and benefits to the patients. Again, as I said, public hospital as digital, that's going to be, it's a massive change. And even one of our work streams at the moment is what we call the virtual hospital. So trying to work as much as possible in a virtual way and plan for it now. 22 operating rooms, and oh my God, could we need those? Because we have that's one of our significant rate limiting factors to our waiting lists at the moment, is that we just don't have enough capacity, physical capacity in the children's hospitals to deal with the numbers that need to do. So we're trying to work in the interim with the private sector and Kappa hospital and things like that to see if we can actually expand our theatre capacity. We have a big focus on gardens in the children's hospital, and obviously the Hematology Oncology is on the first floor there, so it actually has access to its own garden. And we are now starting to look at what is the design of those and how can they be maybe sponsored and developed and assigned to particular areas to get people involved in how actually progress that. So this is the aerial view of the, so this is, if you know St. James's, so on the top left over there, that's all St. James's. You see the rooftops, and over that white building with the windows on the far left, that actually is the new MISA building. That is the Mercer's Institute for Successful Aging. So this is from the Kilmainham end, and it's a camera that's, or it's a, what you call it, a drone that has flown over the building site, and we're looking back over towards Rialto. So that's the road on the right is the new road that has been put in, and you see the white van at the top of that road on the right. That actually is the is Brookfield Road, and the shop at the corner there with South Circular. So this then is a further thing which I think is, yeah, this is the one I wanted to get to. So what we've started to do is name the units that actually that are being built at the moment. So as you can see at the top of the picture is the hematology oncology ward that was worked up until March. So it is the first of the inpatient beds, that oval area that's been developed, and directly underneath that we have all the therapies. Massive area that has, you know, that's where the things like the swimming pool, the gym, out into the gardens, there's outdoor gym, you know, to help with particularly physical movement, occupational health, all of our support services, dietetics and social worker. And then we're into surgical ward cardiology, because they very much linked with across the ward, which is theatres and critical care. And then on ground floor, we have radiology and outpatients, and underneath that, we then have the central decontamination unit and plant rooms. So that's where we are with that, with, you know, a significant amount of the infrastructure of the hospital certainly poured and ended in place before the lockdown for COVID. Another view of it, and this is again on Brookfield Road. So this is the corner junction with South Circular Road, with the, as I keep saying, with the shop on the right. So I think this was taken in about January time. And as you can see there, it's the same view of where the oncology ward is, in the workspace, and reaching out along that road. They're actually putting, you can see, just see where that sign where it says surgical ward, they're actually starting to put in some windows. You know, it's kind of scary. You know, when Dermot Bannon starts talking about the windows, you know, and how room to improve, you know, you're near the getting into a serious state. So they're now starting to put some of the windows in, which is kind of exciting and scary. It's very hard to see. This is the concourse. It's a massive space down the centre of the hospital, because we just want to manage the footfall and throughput coming through. Our Mech and Elec guys have been extremely busy, and they actually have fully fitted out now the steam rooms. All of the pipes have gone in for the fire prevention, and the air cooling handling units are already in place as well, and all of the piping and everything has been put in at the ground floor and working its way up. This is the car park, basement level. So it's, again, there looks like almost ready to go from most of the major infrastructure. Obviously then with the parking company, they'll have to come in and mark it out as relevant. So not just what's happening internal, but external to the hospital. People might be aware of the linear park. This is the piece of green land that goes along the Lewis line. So there's been a proposal with our colleagues in Dublin City Council, Parks and Landscape Services, where they've been drafting a master plan for that to actually help that area look an awful lot more welcoming and as a green area within the inner city. So the council has been held workshops, and they've had some inputs into actually devising that plan, and we're trying to make it, you know, as child-centred and as something as welcoming, so that people who are using the Lewis, which people can and will do certainly from Houston, will actually see that as an area. Plus we see that some of our staff and patients can actually go out and enjoy a little bit of outside space. So those are some of the external images, and again some of the internal images that people may have seen. So we're pretty much into furniture and fittings, and all of those colorings and those sort of elements and decisions have been made on those, which is really quite scary, because some of the furniture, the fittings for the furniture has to go in now. So we've had to make some decisions even recently around, you know, where are we going with putting our signage and everything up. So it sounds very advanced, but to get some of the joinery in place, they need to actually do some of the initial work now. So I think that's my last thing. Oh yeah, so the overall plan, this is a 10-year plan. Gosh, nothing like a big project to extend over a period of time. So we are currently we're on track, and before the COVID kicked in. Currently, as it stands, the contractor hasn't returned. They're still working through the health and safety issues with the development board. It's quite a confined site, you know, compact site, so they have to actually do quite a bit. And there would have been about 800 to 900 workers on the site, which is quite significant. So I think there's some challenges that they're still trying to work through at the moment. So I think that's mine, Brian.
Thank you very much, Eílish. Just 1 or 2 questions before we start.